Well, warm welcome to this talk. Now, I've no intention of inflicting very much of the UK COVID inquiry on you. I'm not convinced how useful a lot of it is, to be quite honest, to your interest. But I am going to include the witness testimony today from Mrs. Ruth O'Rafferty of the Scottish Vaccine Injury Group, who is a self-injured. Now, I found this whole thing really quite frustrating to watch. It was a bit like being in a courtroom. Why it has to be such a legalistic approach, I don't know. I would have preferred more of a medical consultation sort of approach, perhaps conducted by a doctor, but it's not what we've got. We've got a King's Counsellor conducting this. A lot of things seem to be outside the scope of the inquiry. I felt quite a few of his questions were lengthy, technical, legal, difficult to understand. I didn't always understand what he was asking, in fact. But we'll go through roughly some of the points that Mrs. O'Rafferty came up with. She talks about adverse reactions, and people in the group were injured and bereaved. You know what that means. I'm not sure we're still allowed to say that, but people were left bereaved. About 750 people in the group. The group is for support and mutual encouragement, which of course is good, and sharing information on therapies, new therapeutic approaches. And of course, we've talked to many people on this channel who've come up with new therapeutic approaches. Unfortunately, many of them are not available on the health service. These new approaches should be getting actively researched, and pretty well, I don't know that any of them are, which is unfortunate, but they're sharing information on therapies that help individuals. And some of the treatments are described as alternative or new treatments, and there's global sharing. So there's tremendous opportunity for researchers, people round about the world, having the same adverse reactions very often and sharing it. But why isn't this being picked up by more formal research? Why aren't the medical journals all over this? Let me know what you think. Many of the members of the Scottish Vaccine Injury Group feel ignored. She complains of a lot of censorship, disbelief from doctors. This is one of the big disappointing things, really. When you're doing a clinical assessment, you have to believe what the patient's saying. If you don't believe what the patient's saying, why bother talking to them in the first place? We have to accept what the patients are saying. If the patient said, I've got a pain, they've got a pain. Pain is what the patient says it is existing when they say it does. And it should be the same with these other symptoms, but often Mrs. O'Rafferty there saying the members felt disbelieved. She wants more funding for research, opportunities missed for research, as she represents the views of the Scottish Vaccine Injury Group. And of course, we've talked to people from Scotland ourselves who've been severely injured as a result of vaccination. I think the council kind of took the view that he accepted that this was her view rather than accepting it was facts. So again, really quite frustrating to watch. I am going to play it to you. I'm not going to play you any of these things, but I'm going to play you the one I've recorded in a minute. And you can make your own judgment. Don't let me tell you what to think. Unexpected side effects from novel vaccines should have been expected. Obviously. If there's going to be a new treatment, why didn't we expect novel adverse reactions? Should have been expected. The group is able to signpost to some help with funding for new treatments, although that's very limited. There's questions on the safety processes, although a lot of that unfortunately seem to be outside the remit of the inquiry. The scale up from trials to mass production, and of course we talked about this with Josh Getsko as well. The variation in the process A and the process B that were used. The Scottish Vaccine Injury Group feel that safety was sacrificed for speed. And she said it's because you're dealing with biologics, any little change can mean a different product. That's a big concern that they have. Issues with viral vectors, mRNA vaccines, lipid nanoparticles. She had concerns with all of these, again, representing members of the group. Because these were never before used, she feels there's a lack of vigilance. And of course, I would agree there was a lack of vigilance. Like someone was paralysed. She gave the case of someone that was paralysed for months. And it turns out there was someone with a similar adverse event on the trial, but apparently this was outside the scope of the inquiry because it dealt with individual cases. Watch it for yourself, see if I'm being unfair, but I found it very frustrating. Lack of doctor preparation. So if the doctors had known more about the adverse reactions that appeared on the trial, that they would have a higher index of suspicion for these adverse reactions coming up. Very frustrated that wasn't done in the view of the majority of the members of the Scottish Vaccine Injury Group. Lack of public information prior to vaccination. I had vaccines before I thought it wasn't a good idea, and I wasn't given a leaflet on any occasion. Never given a leaflet. So she said that this lack of information before the vaccine constitutes a lack of informed consent, lack of benefit risk analysis. She was very concerned about the yellow card scheme, a lack of awareness. A lot of people simply didn't know the yellow card scheme existed. Of course not. Why should they? It's a medical reporting scheme. People didn't know about it. Perhaps only 1 to 10% of people reported. And she gave examples of doctors not reporting on the yellow card scheme. Basically, she thought the yellow card scheme was not fit for purpose. Issues with the vaccine payment scheme. How do you work out? How do you give evidence that 60%, you have 60% disability? Over onerous to meet that criteria. People applying for vaccine injuries scheme found it a traumatic experience. These people have already been traumatised. They shouldn't be traumatised twice. Applicants have to prove causation. How does a layperson prove causation if they don't have that background knowledge? Very, very hard to do. And a lot of her members' appeals for compensation were rejected. So that's just a few things what she said. I'm going to play. I'm not going to play any other ones from the vaccine, COVID vaccine inquiry, module 4, the UK COVID inquiry, module 4 dealing with vaccines and therapeutics. But I'm going to play this one and make what you will of it. But I warn you, it is quite a frustrating watch. So I put it on largely for completeness, but there we go. It's there now playing if you want to watch it and see if I've given a fair assessment.
I'd like to start your evidence, please, Mrs. O'Rafferty, by asking you to tell us something about the Scottish Vaccine Injury Group, whom you represent today. We understand that it was initially formed to apply for core participant status in the Scottish inquiry, not the UK inquiry, but the Scottish inquiry, but perhaps more importantly, to provide tailored support for Scottish people who had suffered an adverse reaction to any of the COVID-19 vaccines. Is that right?
That's correct.
Within your group, do we presume, therefore, that there are people who suffered injury as well as those who, worse, suffered bereavement following vaccination?
Yes, we have both. The majority suffered vaccine injury.
Can you give, please, the inquiry some idea of the size of the Scottish Vaccine Injury Group? How many interests or how many people are you representing, and how many people are you looking after their interests for?
Currently, just approaching 750 people. We have about 680, I believe, in the Facebook group, and we then have a number of individuals who've joined us for the inquiries, so we just message each other and keep in touch by email.
You've set out in your witness statement, we might have it up on the screen, please. It's INQ 000497102 at paragraph 3, the extremely worthy aims of your group. And I would just like to ask you about some of them. You refer in paragraph 3A to the aim of preparing for the Scottish and UK public inquiries. That's self-evident. And you refer in B to the support and encouragement, to which you've already referred, for those who suffered adverse reactions. And you refer to the Facebook group in C. D, you refer to the sharing of up-to-date information on treatments and therapies. Presumably that's a matter of great importance to the members of your group, because you will be privy, no doubt, necessarily over the passage of time, to much more information and detail on treatments and therapies which you've come across, which you can disseminate to their great assistance.
Exactly. And there's a lot of treatments which would be viewed, I suppose, as alternative treatments, like infrared, near-red light panels, hyperbaric oxygen therapy, things that we wouldn't necessarily be recommended on the NHS. And we're part of a global coalition of vaccine injury groups, so we share things with each other globally, which is very useful.
At E, you refer to the aim of seeking to raise awareness of vaccine injury to the public, media, political arena and healthcare system. I referred in my opening, as you probably know, to the public interest in trying to reduce the stigmatization of which you speak in your witness statements surrounding those who believe themselves to have been injured by a vaccine. Is this aim to raise awareness of vaccine injury there because there are many people who doubt whether in fact the vaccines cause injury? And of course, it's a very strongly held view on the part of our members that they have to a large extent been ignored.
Yes.
Is that the nub of this?
Yes. There's been a lot of censorship. In fact, Mark Zuckerman's openly talked about how Facebook removed anything related to vaccine injury. So what we experience when we go into medical appointments are medical professionals who've not seen evidence of vaccine injury in social media or the mainstream media. So we're actually met often with quite a lot of disbelief. And actually, we did a survey in our group to find out how doctors seem to feel about vaccine injury. And 46% of them said, or the 46% of the respondents said, that even though doctors said to them, yes, we think this was the vaccine that caused this, they didn't write it in their medical notes. There's an element of fear there that if you speak out against the vaccines, you're going against the societal or cultural expectations that the vaccines are wonderful.
All right. Is it in part because your members feel that they're not being heard, they're not being listened to, and also that there is a degree of ignorance or suspicion perhaps about the injuries that they've suffered, that you have, as you set out at G, also sought to campaign for specialist funded research and specialist centres so that your members can receive the treatment for the injuries which they believe they've suffered from vaccines?
Yes.
Right.
And in fact, Germany, there are specific units that research vaccine injury and long COVID, both, because there is an overlap in symptoms. And we feel that because these were novel technologies that we used for the vaccines, there will be side effects that maybe will be unexpected. And we're very surprised, actually, that nobody has come to us and said, well, look, you are this wonderful research opportunity that we have to find out what's happening as a result of the vaccines. So,
am I right in saying that this is the first occasion on which a representative from your group has given evidence to obviously a public inquiry, but also
yes.
the public by way of a select committee or some sort of organisation?
As far as I know, yes. Right. I believe UKCV Family may have spoken to some parliamentary members, but we haven't. And
then the last two subparagraphs, F and H, similarly identify that the aims of the group include trying to signpost people towards help and also setting up the charitable and administrative systems to fund particular treatments that aren't available on the NHS.
Yes.
So that gives us some idea of the aims. Now, in your statements, you have, I should say, and this will come as no surprise to you, I know, raised a vast number of points and issues, spanning the technology of vaccines, the scientific foundations for them, their authorization, their research and development, their delivery, in fact, almost every aspect of vaccination and vaccines. Today, I'd like you, however, to try to help us with expanding on those issues and those concerns that your members hold, with a particular focus on the list of issues, the scope of this inquiry and this module. That there are obviously a all number of points and areas and issues which fall wildly outside the scope of this inquiry, and I don't want to take time looking at those. So in no particular order, but it's a topic that you refer to repeatedly in the course of your statements. You identify that one of the main concerns held by your members is of course, the integrity of the regulatory system in the United Kingdom, the degree of scrutiny that was brought to bear on the authorization of vaccines, and whether or not the safety processes were properly operated, and in particular, whether they were designed and operated in a way that would bring safety-related concerns, side effects to light. Is that a fair summary of that particular topic?
Yes.
Do your members have particular concerns about the administrative or legal routes by which the vaccines were authorised? You've referred in the statements to the authorisation process under Regulation 174 of the regulations to which I referred yesterday. What is the concern on the part of your members as to whether it was Regulation A or Regulation B or some other legal route that was operated?
I think I will try to answer that question, and I don't think I'm knowledgeable enough to answer it in great detail. But from our perspective, the MHRA and the government faced a very significant challenge, and they put in place some updated regulations to allow them to authorise vaccines under very fast processes. I'm not really quite sure if I understand exactly what your question is, to be honest.
But are they concerned about the particular legal route or administrative route that was deployed? So are they worried that there was this legal process under Regulation 174 that was used, or are they worried about the way in which, in detail and in practice, the MHRA went about deciding whether to authorise vaccines?
I think the latter. And shall I expand on that just now?
Yes, please do.
Okay. So the one of the main things that we are concerned about is that in 2005, there was a parliamentary review into the influence of the pharmaceutical industry on the regulatory process in the United Kingdom. And they made lots of recommendations all those years ago, which still have not been implemented.
All right, we're in danger of veering off already.
Okay. So that provides some context
right.
for what I'm just about to say.
Please continue.
Mm-hmm. So a normal process when a new medication is brought out is that they'll make a mock-up of a medication or a vaccine for a clinical trial, and then once it's been authorised, they will then upscale and produce a product that can be mass-produced, because you can't. The way something's made for a clinical trial, you can't mass-produce it. These particular vaccines are biologics. And there was a research study that's in...
I'm so sorry. I'm going to have to interrupt you there. We don't have the time or the wherewithal to be able to go into some of these things in this sort of detail. Could I put it another way to you? Mm-hmm. It is the core concern of your members that does it revolve around the system by which, in reality and in practice, the MHRA authorised the vaccines, including whether they properly scrutinised the manufacturing and process systems for the production of those vaccines, whether or not the safety trials were properly conducted, whether or not the clinical process was subject to the same degree of scrutiny as the rollout process. Are those the sorts of issues that they're worried about?
Shall I put it another way?
Yes, please.
Your fellow members feel that they sacrifice safety at the expense to gain the speed?
Yes, Thank you. Yes.
So it's the rolling review issue. It's the overall speed by which authorisation was granted and the degree to which they examined it.
No, we understand the rolling review allowed them to see things a lot sooner, so they were able to scrutinise things much more quickly than they would normally, and we don't have a problem with that. What we have a problem with is the upscaled product. Because these are biologics, and because the process defines the product, if you change any little thing in the manufacture of a biologic, the temperature, the ingredients, where it's made, you can get a different product. And there was concerns raised that whether the upscaled product was comparable to the clinical trial product.
As I've said, the two processes, the one that underpinned the clinical research and the one that underpinned the at-scale manufacturing.
Correct.
All right. I think we're clear. From your statements, it appears that there are wider issues raised also by your members about the degree to which the data, the trials, the studies and the statistics were properly scrutinised, whether they were accurate, and whether or not the MHRA had before it all the necessary information they needed to properly make a decision on authorisation.
Yes.
Yes? All right. There's quite a strong scientific edge. There are a lot of scientific issues raised in your statements. A great many paragraphs devote themselves to concerns by your group on the technology underlying vaccines. So, for example, vector-based vaccines, the mRNA technology, the use of lipid nanoparticles, I could go on. Is the scientific technological basis of the vaccines a matter of concern for your members? Or are they concerned about the administrative impact, that is to say, the decision to authorise?
All of the above.
All the above.
Yes.
All right.
These are mRNA vaccines have never before been authorised for use in the public. And because they were brought out in such a massive scale, our concerns are that there wasn't enough vigilance, that doctors were not aware. For example, we had somebody who ended up in hospital paralysed for months. And we discovered that she had the same diagnosis as a condition that appeared in the AstraZeneca trial. Had her doctors known that had happened during the AstraZeneca trial, the trial was actually paused.
Right. There's a number of, I perfectly understand that you hold those beliefs, but there's a number of assertions or observations made in the course of that answer, which we haven't got time to unpick now. The overarching view, though, the overarching position is, you are worried about the scientific superstructure or underpinning of vaccines and whether or not it was properly understood when it came to authorising their use in the United Kingdom. Is that the heart of it?
Yes, whether the doctors actually understood this is a brand new technology, if they had understood the conditions that had arisen during the clinical trials or not, because had they known, they may have been better prepared to diagnose more quickly,
right.
And then those conditions wouldn't have advanced to the stage they did where there's irreparable damage.
Or they would have been treated perhaps in a different way.
Yes.
Right. Much of your statements is concerned with the separate but no less important issue of public messaging. Mm-hmm. That is to say, informing the public about vaccines, about their benefits, about their risks, and about the specific emerging knowledge about the very rare risks that vaccines might give rise to in a number of different ways. So, were you and are you concerned about the whole patient information leaflet process? Whether or not it gave the public enough information, whether or not they were updated in sufficient time when new data and new understanding came to light, whether or not people, when they received their vaccines, understood that there was a patient information leaflet available which might or might not have the right degree of data. Is that Is
This
that
is
the broad
correct.
area?
A lot of our members were not given a leaflet until after they'd received their vaccination, which means they didn't really have informed consent. They didn't know what they were consenting to. And the leaflets really, we now know the level of damage and the level and breadth of injury that can result.
Well,
and these are not listed in the leaflet.
Right. So your general position is that you believe that there was more injury, more damage, more harm done than was being indicated by the patient and public-facing leaflets and information, both from the MHRA, from the government, and from these public information documents.
Yes, and the doctors rely on the Green Book, for example, and that only mentions myocarditis, thrombosis, and Guillain-Barré syndrome, really. And we have so many more other undoubted vaccine reactions.
Another topic, another important issue is, and raised by your members, is whether or not, despite there not being a formal vaccine as a condition of deployment policy in Scotland, Wales and Northern Ireland, that they feel that there's a perception, or that they perceive that people were nevertheless coerced, publicly or privately, into taking vaccines. Mm-hmm. So is the heart of the concern expressed on this topic whether or not the state, the government, were fair and open in describing the benefits and the risks so that people could make a decision individually for themselves without feeling they were under a degree of coercion?
Well, we had language even in the speech.
I don't want to go into the detail
of
specific cases, because we can't do anything about specific cases, but is that a proper summary, if you like, of the overarching concern?
Published message was you would take the vaccine to save everyone else, that you were selfish not to, you were responsible not to. And we did have lots of people in our group who were in the medical profession who were coerced. We even had somebody who had emails distributed around their workplace naming and shaming people who hadn't yet had their vaccine.
All right, you understand, of course, that we can't delve into individual cases.
No.
But the overarching point is you're concerned about why it was that some people felt they were being coerced or they were under pressure, and whether or not they were given the right information to be able to make a decision free from coercion.
Yes.
That's the heart of it. All right. The yellow card reporting scheme is obviously a vital part of the safety structures in the United Kingdom. Is that a general topic about which your members have expressed a great deal of concern? In essence, whether or not it properly allowed people to record, to register with the government and the authorities adverse effects which they believe they'd encountered, and also whether or not, going the other route, the yellow card scheme and the MHRA kept people properly informed about the position. Is that the heart of the concern?
A lot of people have never heard of the yellow card when they join the group, to be honest. And then we have people who haven't been able to access the yellow card again. They can't find it. The yellow card scheme is a passive reporting scheme, as you know, so it's reliant on people knowing about it. And the government does, by their own admission, say between 1% and 10% of people actually report to the yellow card.
And it's obviously a scheme whereby members of the public and medics can report. And so your position is that people weren't made properly aware of the availability of the yellow card system to allow them to report.
Yes, although it does say about the yellow card in leaflets. But our experience is that doctors were not reporting to the yellow card, even though they said to us that they felt that the vaccine was responsible. And in fact, the Green Book says that all doctors should, even if they're not sure, they should report it to yellow card, and then MHRA will make the decision whether or not there was a causation there or not. So yes, we feel that the yellow card is not fit for purpose. I know that I asked for a copy of my yellow card, and they put that a lot of my symptoms had been resolved when they haven't. So I don't know where they got that information from.
And finally, another scheme, no less important, but it's one that appears to be of huge concern and worry to members in your group and other groups, I should say, is the vaccine damage payment scheme.
Yes.
Has it been the experience of your members that where they've made applications under the scheme, that they've simply not been dealt with sufficiently speedily or at all, or got a positive response? And no doubt you would argue that the actual terms of the scheme, the preconditions for an award, and it's not a compensatory award, but for an award, are overly onerous and impossible in practice to meet.
Yes. I mean, how can you prove you're 60% disabled when your condition fluctuates from day to day? It's actually the response that I get from group members, overwhelming responses. It's a very traumatic experience to go through. Because a lot of them, I mean, I'm having quite, I'm losing my words here, but a lot of us are neurologically impacted. So we find it difficult to communicate. And we have some people who are so badly injured that they can't actually write. So they're trying to get medical records from here, there, and everywhere, collate it all, and they have to prove causation. I mean, how can a normal layperson do that? It's very traumatic. And then when the results come back, and a lot of them, most of them come back the first time round as rejected, and some of the reasons are utterly ridiculous, to be honest. Somebody was accused that individual members. Okay.
Thank you very much, Mrs. O'Rafferty. If I may say so, you've been a very fine advocate, despite your own words, in the interest of your members. But that gives us a very helpful understanding of where the main points of concern are and the scope of them.
I was about to say something similar. You say that people very often have problems communicating. Well, thank goodness today you obviously feeling on top form for communication, although I appreciate your condition may change on different days. The thing I was quite particularly interested in was you talked about the research in Germany about both vaccine injury and long COVID. And I've been going through your statement, and don't worry, I will go through it all in some detail before I reach any findings. Again, I have been through it, but I'll go through it again. But I was interested because a lot of the concerns that your members have echo the concerns that long COVID sufferers have. Recognition, of course, being one of the primary ones, and then the kind of support and treatment that you need. So I was quite interested to hear you talk about that research. Anyway, thank you very much indeed for your help. I'm really grateful to you. I hope it hasn't been too difficult getting here and getting home.
Thank you.